Hey there, my name is Megan Cleanahan, and it is the month of love. It is February, but as many of you know, February is also Heart Month. In this month, with our series with UTMB Health, we specifically wanted to talk about women's heart health because it's super important that we as moms stay as heart healthy and healthy as possible for our children that we are raising. So, of course, we had to bring in an expert. So, joining us this morning. How are you?
I am good, Megan. Thank you for having me.
Yeah, thanks so much for joining us. Do you mind telling us a little bit about your background and where you practice within UTMB Health?
Okay, so I am a cardiologist at UTMB Health. I practice at the Galveston campus and see patients at the Galveston campus. I am subspecialized in advanced cardiac imaging, which basically covers um, imaging modalities like cardiac MRI and cardiac CT that gives us a little bit more insight into the cause of various kinds of cardiovascular disease. I am also a mom of two lovely girls, 11 years old and 14 years old. So I'm happy to be participating in this.
Yes. Well, thank you for taking the time. I know juggling and balancing that the professional life and the mom life, it takes time. So we appreciate you spending a little bit of time with us this morning to talk about heart health specifically in women. And so can you share any current stats of what is happening within heart and women's health?
Absolutely. So I think the biggest statistic that is the most important would be cardiovascular disease is the number one killer of women. And it causes 1 in 3 deaths each year. And when you compare that to men, men have 1 in 5 deaths for men. So it is more frequent in women. To actually put that in context, when we talk about breast cancer, a woman has a 1 in 8 lifetime risk of developing breast cancer. And of all the female cancers, 1 in 3 of all new female cancers is breast cancer. But the chance of dying from breast cancer is 1 in 43. So when you think about that, a lot of women know another woman that has had breast cancer, but we really don't think about the fact that, well, cardiovascular disease is even more frequent than breast cancer because 1 in 3 of our friends, our coworkers, mothers, sisters, from the age of 20 years old has or will die of of cardiovascular disease. And when we talk about cardiovascular disease, we're really lumping all the kinds of cardiovascular diseases together, ranging from coronary artery disease, which is having plaques in your arteries that causes heart attacks, or high blood pressure, or rhythm problems, or heart failure, or heart valve problems. So it's really a very wide range of diseases when we talk about cardiovascular disease. And that's 1 in 3 women.
So I think when we look at that or hear that, that can be pretty alarming. Um, that's scary for me to hear, quite frankly. Um, why do you think? I mean, if men are 1 in 5, women are 1 in 3, what is there a specific reason that is, or is it just kind of an anomaly?
It mainly has to do with one, our biology as women, but also the fact that, especially as a mom, when women feel symptoms of heart disease, we tend to blow it off. We tend to make excuses for our symptoms. Oh, I had a bad day. Oh, I had a stressful day. Oh, I'm having a period. Oh, I'm going through menopause. I just had night sweats. And so that increases our risk of dying from something that could have been caught early on. And that contributes to it. We're juggling a lot of things as mom, right? You're juggling taking care of the family and taking care of work and going to the grocery store, that we tend to put ourselves on the back burner, such that
Yeah.
when we get these warning signs, we don't pay as much attention to it as we should. The same shortness of breath that a man may have and he would complain about it, a woman has the same shortness of breath, but she'll just, I had a bad day at work, I'm just going to lay down and wake up the next day. We go through it. It is
Yeah.
addressing it when it occurs.
So I think that's so true. And one thing, we kind of make fun a little bit of are the men in our life of, oh, they have the man flu, they have a cold, like, and they're hyper aware of their symptoms and how they're feeling. But this actually may be the one thing they might be saving their life.
Yeah.
And maybe women are ignoring that a little bit. I know that I'm super guilty of it. As soon as you said, like we brush off symptoms. Like I went to the dentist and they took my blood pressure and it was high because I'm at the dentist, but it's high because I'm at the dentist, and kind of can brush that off a little bit. So what are some things that women can do to really take charge of their heart health? And what would you encourage the moms in your life to do?
I would say that the main things we can look at it from a physical aspect and then a mind aspect. And I think a lot of times we tend to brush up how important taking care of our mental health is. So taking care of our mental health is a big thing. Being able to manage that appropriately for women is very, very important. But then when it comes to the physical aspect of taking care of your health, the basics of healthy living, which would be physical activity, having at least 30 minutes of exercise at least 5 days a week, a total of 150 minutes would be what we aim for. And it doesn't really matter whether you go to the gym versus just going for a simple walk outside.
Mm.
That alone can reduce your risk of heart disease. Things like eating right, having a healthy diet, a Mediterranean diet or a DASH diet. So diets rich in fruits and vegetables and plants and less of red meat like in the Mediterranean diet, or a diet that is rich in nuts and legumes and a little bit of skinless poultry or a little bit of healthy fish. Those are things that we can do from a dietary perspective. The other things include knowing what your family history is, right?
Mm.
There are things that we could potentially change, like our lifestyle and our diet. But knowing what your family history is, knowing what you're at risk of, like if my mom had a heart attack at the age of 30 years, well, maybe I got those genes too. And so going to see a doctor, and that may be your primary care physician or your cardiologist, to check things like your blood pressure, things like your cholesterol level, looking for things like diabetes, making sure that all those things are controlled and being proactive about our health is extremely important. Our weight, staying in a normal weight range. A normal BMI is anything from 21 to 25. So doing something proactively to keep us in a normal healthy weight range is something that we can proactively do. And when we're being proactive in checking our health, sometimes you don't even have to go to the doctor. Right now we have a lot of digital devices that we can use at home. I have an Apple Watch, and sometimes I just look at the rhythm of my heart to make sure that I'm in a normal sinus rhythm and I don't have any extra beats. Or something like when I go to the grocery store, a lot of the grocery stores have like a blood pressure machine in a corner. I just sit down there and stick my hand in because, okay, I'm not going to the doctor, but at least I can get a blood pressure there. And if I see that my blood pressure is high there, that's not the doctor's office. I can't say it's white coat hypertension. So something's definitely happening. And so taking the next step and saying, okay, I really need to go and check this out with my doctor. When we feel things like a little bit of chest pain that doesn't feel right, chest pressure, jaw pain, shortness of breath, unusual nausea, vomiting, epigastric pain, something just doesn't feel right. And I think one thing I will say about women is that we have this sixth sense, right? Especially as mothers, you kind of know when something is brewing. You know
Mm.
something isn't right, whether that's for you, your spouse, or your kids. And tapping into that feeling and holding on to that feeling and saying, I know something did not feel right when I felt what I felt. And taking that to the physician and especially advocating for yourself as a woman. Because when you go to doctors, it is well known that half the time when women complain about chest pain or palpitations, which is feeling my heart racing like it's going to jump out of my chest, or unusual shortness of breath, most of the time we are told that is anxiety. But what I tell my patients is, well, something is causing that anxiety. So it's not about treating the symptom of anxiety, it's treating the cause of that anxiety. And so a woman has to advocate for herself and say, no, I felt anxiety before. This is not a panic attack. Something is going on. And the beauty of cardiology right now as a subspecialty, and specifically what I do, which is advanced cardiac imaging, is that we have non-invasive tests that can look inside the human body and detect disease before it begins to cause a problem. Something like a calcium score, something that I would say, I tell patients it's like a mammogram of the heart. A mammogram is about 85 to 90% accurate, but a calcium score is 98% accurate in terms of picking cholesterol plaques in your arteries before it begins to cause a problem. So having something like that, just a simple screening test, is very helpful. And advocating for yourself, I think, is very helpful as well.
I am so glad you brought that up because I think a lot of times there have been times, and as women, when we go to the doctors, that we're brushed off as being hyper or overly sensitive, or or they'll look at you like, for me, I'm not like a big person, and they'll be like, well, but you're young, um and you look relatively fit. Well, they don't know. I
Yes.
haven't run in 2 years, but um so I think I usually try to take notes before I go to any sort of doctor's appointment, because I need to have something that will like help me be brave when I'm sitting there. If I were to get pushed back, I need to be like, well, but I have this. And then I
Right.
kind of make mental notes to myself. So I'm so glad you brought that up. So let's say we're having symptoms, or maybe we're not. Like, is there age of when we should see a cardiologist? Is this something we take to PCP first? Like, when do we go to you? I guess is my question.
When you're concerned enough.
Okay.
So I would not even put it down to an age, because with adult cardiology, we're starting from the age of 20 years, 21 years old. Ideally, you should have a PCP's visit, right? And the PCP is going to take your blood pressure and is going to check for your cholesterol and your regular labs, your kidney function, your liver function, and all of that good stuff. But when you get to the point with your primary care physician where you're not getting the answers that you want, there is nothing wrong in asking for a referral to a cardiologist. Now, if your primary care physician has identified a pathology that requires a specialty like cardiology, maybe complicated high blood pressure, where your blood pressure is resistant and difficult to control, or where your primary care physician hears a murmur and we need a test called an echocardiogram, which is an ultrasound scan of the heart. If you have a family history of, premature heart disease, where people are dying of a heart attack before the age of 45 years old for a man, or 55 years old for a woman, those are things that should tell you. Or even when a woman has gone through pregnancy and they have something called preeclampsia, where they have high blood pressure in pregnancy, or a woman is going through menopause, where at that time our hormones are kind of transitioning from the estrogen to the testosterone, and are going through a lot of new symptoms, right? Our body is changing at that point. If things don't feel right, ask for a cardiologist visit. There is nothing wrong in being proactive. Your primary care physician will screen you for the general cholesterol and high blood pressure. But if you get to the point where something doesn't feel right, ask for a referral to a cardiologist. And when you come to us, not only do we have access or information about a wider variety of non-invasive tests to evaluate you, but we tend to look at those numbers differently. And I'll give you an example so a patient, we call this clinical inertia, where, like you mentioned, you keep going to the doctor's visit, right? You keep seeing the blood pressure. It's 145 over 85, 150 over 90, multiple times over multiple visits. And the patient is still not on high blood pressure medication, because we've been saying it's a doctor's visit. It's white coat hypertension. Well, white coat hypertension is still hypertension. So at least going the next step to say, well, your blood pressure is high in the office. I want you to get a blood pressure cuff at home, right? You can get it for less than $20 at the grocery store. Start to take a self blood pressure monitoring at home. You check your blood pressure in your comfortable setting. In the morning, in the afternoon and in the evening, and write it down for about a week or two, and then come back and we'll talk about those numbers. And I can't tell you how many patients we have diagnosed high blood pressure just based on that owning their health, right? You go home, you check your blood pressure. This is a partnership. I will help you take care of the disease, but you come with the numbers and convince yourself that your blood pressure is actually high in your own comfortable environment. So little things like that. By the time you have gone from a primary care physician, you get to your cardiologist, we are going to initiate your blood pressure medication. The same thing with your cholesterol numbers. An LDL cholesterol, which is a bad sticky cholesterol, could be about 130 for a 45-year-old female. And that would be, it's high, but it's okay. It doesn't require additional medication at that point. However, if you have a family history of heart disease, or you have things like autoimmune diseases, lupus, rheumatoid arthritis, I would screen you a little bit more. I would send you for a calcium score. I would want to see if you already have evidence of disease. And at that point, a number of 130, an LDL of 130, is no longer good enough. I want that number less than 100. I may even push it down to less than 70. But at that point, I'm initiating medication like statins that can help reduce your risk of having a heart attack down the road. So being more aggressive with the same numbers that your primary care can see, that is what you get with a cardiology visit. And then, of course, the imaging modalities that we can use in cardiology, some of them are not readily available to a primary care physician. So a primary care physician can order an echocardiogram, which is a simple ultrasound scan of the heart. It's going to show me how well your heart muscle is squeezing. It's going to show me how your valves are working, show me if there's any damage done to the heart muscle. And your primary care physician can order that. An EKG is a simple rhythm strip that tells me, is your heart rhythm normal? Primary care physician can order that. But then when it comes to more complicated tests or more complex tests, like maybe a stress test, where I ask your heart muscle to work harder than it typically works, or a coronary CTA, which is a non-invasive CAT scan that is specifically designed to look at your blood vessels. It's like a virtual cardiac catheterization, where I look inside your blood vessels, I see if you have blockages, I see if you need a stent, or a cardiac MRI, where it shows me if you have any damage done to your heart muscle. That's a magnetic resonance image of your heart. All of these tests are not things that your primary care physician will routinely order. And if your symptoms are concerning enough, at some point, you do want to go to the cardiologist so that we can evaluate you further. And the beauty of what I love in cardiology, especially cardiac imaging right now, is that I can do all of this without poking you, without a procedure, without a surgery. Pretty much go, get a screen, get a non-invasive test that is very, very accurate, and we get answers.
I mean, we all like to hear that we won't be, hurt or during the process or
That is correct.
what have you. And that brings, I think, a little bit more peace to people's heart. And one thing, no pun intended, one thing that we always mention here is that it's so important to have a primary care physician that you know and that you trust, who knows you. So if your numbers start to spike, then they're not going to hesitate to get you that cardiology rec. And so hopefully you don't have to do quite as much as that of the advocating. But if you don't have a primary care physician, UTMB Health has a ton of them. And there is one for you. We will drop in the comments below a list of physicians that you can find that you can go see. And then we're also going to drop cardiology, of course, below, so that you can find a doctor that can help you with this imaging, where what I'm hearing, kind of the theme of this video, is really women taking control of their health and being responsible, loving ourselves enough during Heart Month to have us keep going in this life. I know I have a handful of years I want to be around for my 14-year-old and all of the things. And I know that would be your goal with your patients as well. I know we talked about a lot of things today. Is there anything we missed or anything additional you would like to say?
Um, I think my biggest message to women is don't hesitate to advocate for yourself and get a second opinion if you have concerns. I think just last week I saw at least two different females that came to me for a second opinion, heading down the road for an invasive cardiac catheterization where women are known to have more complications compared to men because of our smaller vessels. But we were able to stop that train and say, no, we've got better tests and we'll get you answers. And their tests came back, one of them came back completely normal and she didn't have to do anything else. And the other one came back abnormal, but we identified what the cause was, that it wasn't anxiety and it was actually a blockage. And she was so grateful because we
Mhm.
were able to initiate medication like aspirin and statins that could help, increase her longevity. And like you said, keep her around for her kids for a long time.
Yeah.
So women advocate for yourself,
Oh,
ask for um if you're not comfortable, ask for a second opinion, ask for a referral, do the work, go on Google, look for the kind of doctor that you want.
oh, we are worth it. And we know that we would do all the steps times 10 for our children.
Correct.
And we
Even for
have.
our spouses, right?
Yes. Oh, for all of well, for the man flu, all the things. We will
Exactly.
do all the Google searches and we owe it to ourselves to do that for us. And it's not a selfish thing.
No, it's not.
It is probably the most loving thing that we can do for our family. I don't know. I feel personally convicted though, after speaking with you, that maybe I'm gonna order a little blood pressure cuff because maybe it's just been a little too long. And so I appreciate that. And I feel like maybe you were meant to give me that message today. So thank you for that. Thank you so much for joining us. We will be back next month with another important video from UTMB Health. Again, we'll pop everything in the comments below so that you can have easy access to physicians and cardiology, and be able to connect with doctors. So we appreciate you. Have a great night. We'll see you later.
Thank you, Megan.